Right now, today, your tax money is paying to lock up people who should be in a hospital, not because they committed a crime, because 60 years ago the US government made a promise to build the infrastructure that would replace its asylums, and then quietly walked away from it. Every dollar you've spent since is cleaning up that mess. The police bill, the ER bill, the jail bill. I am Felix. And the part that should make you angry isn't that it happened. It's that nobody ever told you it is still happening. To understand why that law existed, you have to understand what it replaced, and what it replaced was something this country spent decades pretending wasn't happening. In 1955, over 550,000 Americans were locked inside state psychiatric hospitals. Not treated, locked. Journalist Albert Deutsch went inside in 1948 and published what he found in a book called The Shame of the States. Overcrowded wards, patients stripped of their names, procedures, performed not to heal, but to manage, to make the inconvenient quiet. And then there was Rosemary Kennedy, JFK's own sister. Mild disability, some mood swings. In 1941, at 23 years old, without her consent, she was given a lobotomy. She never recovered. Kennedy never forgot it. That was the system everyone, left, right, doctors, lawyers, agreed had to go. The question was, what comes next? On October 31st, 1963, President Kennedy signed the Community Mental Health Act. It would be his final major piece of legislation. 23 days later, he was dead. The plan was genuinely visionary. For the first time in American history, the federal government would take direct responsibility for mental health. 1,500 community centers spread across the country. People would get real help while keeping their homes, their jobs, their lives. Kennedy called it replacing the cold mercy of the asylums with the open warmth of community concern. Felix needs you to hold that phrase, because here is what actually happened. Of those 1,500 promised centers, only 761 were ever built, half the promise. And the half that was built was chronically underfunded almost from the day it opened. And the hospitals? They were already closing. Here's what nobody explains about the 1963 law. It funded the buildings. It did not guarantee the staff, the doctors, or the medication management inside them. Think of it like an owner who promises their cat a new home because the old one's condemned. They build the walls, they skip the roof, and then hand you the keys in a rainstorm. The funding was supposed to follow in subsequent rounds of government spending. It came, but inconsistently, partially, never at the scale required. And then in 1981, one paragraph buried inside the Omnibus Budget Reconciliation Act converted what remained of the mental health money into something called block grants. That single paragraph rewrote the deal entirely, and almost nobody noticed, because it was hidden inside a budget bill no one was reading. Block grants sound like a technical detail. They're not, they're a trapdoor. When mental health funding became a block grant, the money earmarked for community centres was handed to individual states as general funds. States could spend it on mental health care, or on roads, or on tax cuts. There was no federal mandate, there was no oversight, and federal spending on these programs dropped by roughly 30% almost overnight. Here's the thing. President Carter had actually seen this coming. In 1980, he passed the Mental Health Systems Act, a direct attempt to properly fund what Kennedy had promised 17 years earlier. A genuine fix for a genuine gap. Reagan repealed it in his first year. The hospitals had closed. The centers had never fully arrived. And the question nobody in Washington was asking was the most important one. Where did 500,000 people go? Felix covers perspectives like this that don't make the evening news. Subscribe before the next one drops. They didn't disappear. They didn't recover on their own. They ended up in the only public institution still standing, the one with enough beds, enough staff, and a legal obligation to take anyone who showed up. The jail system. Today, the 3 largest mental health facilities in America are not hospitals. They are Rikers Island in New York, the Los Angeles County Jail, and Cook County Jail in Chicago. According to the Department of Justice, up to 64% of local jail inmates show symptoms of mental illness. The Treatment Advocacy Center found there are now 10 times more people with serious mental illness in prisons and jails than in all state psychiatric hospitals combined. We didn't end institutionalization. We outsourced it to corrections. And here's where the story stops being a policy failure and becomes something more uncomfortable. Because this wasn't just about money. It was also about a genuine civil rights battle, and that battle was won. Which makes what happened next hard to sit with. In 1975, the Supreme Court ruled in O'Connor versus Donaldson that you cannot involuntarily commit someone unless they pose a clear and immediate danger. This was called the least restrictive environment doctrine, and it was the right call. The old system had committed people for being inconvenient, for being a woman who pushed back too hard. The courts were right to stop it. But the ruling was designed for a world where 1,500 community centres existed. Without them, the least restrictive environment for someone in a psychotic break wasn't a clinic, it was a park bench. So back to your money. Because this is where the savings from closing the hospitals actually went. A properly funded psychiatric bed costs around $200 a night. A jail cell costs closer to $2,000. The money that was cut from mental health didn't disappear. It was quietly redistributed into police call-outs, emergency room visits, public defender caseloads, and a corrections infrastructure that was never designed to treat anyone. According to the Treatment Advocacy Centre, the 3 county jails Felix mentioned earlier spend more on mental health management than most state hospitals ever did, and achieve a fraction of the outcomes. The decision to close the hospitals and defund the centres wasn't fiscally responsible. It was a bill passed to someone else. Someone always pays. It just stopped being the people who made the decision. So who's responsible? Felix isn't going to tell you it's one party. Because this wasn't one party. It was a Democrat who started the plan, a Republican who cut it, and a court system that protected civil liberties in a world where the infrastructure for those liberties had never been built. And who filled the gap that left behind? Your local library. Think about that for a second. Librarians across America are now, functionally, the front line of the mental health system, acting as social workers, crisis counsellors, de-escalation staff. They didn't apply for that job, they inherited it. Because the library is the only public building still standing from a plan that was abandoned in 1981. That's not a metaphor. That's just where the money stopped going. In 1955, America had 339 psychiatric beds per 100,000 people. Today, 11. 97% of the capacity. Gone. Not because the need disappeared, because the funding did. Somewhere in the gap between those two numbers is a person who was supposed to have a place to go. They still don't. And every institution that was never built is now a jail cell, an ER bay, or a library floor, being paid for every single day by you. The 1963 plan wasn't wrong. It was just never finished.